I used to snore at 90 decibels. Just imagine.
Wow.
It's like noise pollution.
Yes, it's noise pollution.
And when we see people who snore, one of the common queries they ask is whom to consult for.
Just imagine we're all awake and the oxygen is being sucked out of the room.
Yes, yes.
You know, just imagine
Just
how much
suffocating.
yes,
Yes,
is there.
Yeah. And nowadays, pediatric OSA is also on the.
I think it's always been there.
Just
that we didn't know about it.
Welcome to DentCare Talks. Myself, Dr. Jamin Elizabeth Matthew. I'm a prosthodontist and technical manager Marcom at DentCare. Snoring may seem harmless, but behind those noisy nights, there are potential sleep disruptors that can affect your health, that can affect your rest and your sleep. So are you curious to know more about what causes it and how to silence it? To know more about it, joining with me today, we have Dr. George, prosthodontist and technical head at DentCare Dental Lab. We have Dr. Vishnu, orthodontist and head of department at DentCare Aligners. We have Dr. Binu, who is an orthodontist and technical advisor at DentCare Aligners. So I feel these days snoring is a very common thing. Like in a house, out of 5, I guess 4 people snore.
Yes.
And I guess because it has become a common thing, I feel people think it's normal. So what do you think, George?
Yeah, I think so. You know,
Yes.
snoring is a big problem now. I'm someone who snores a lot or who used to snore a lot. So the main thing I feel is people think that snoring is okay. Like Kumkarna, you know, the traditional.
Kumkaran.
It's considered to be sound sleep. Yes, yes. And I think like last month I had gone for a trip. So many of my friends know at night when we slept, like they were snoring. So right now, earlier it was used to be considered as a sign of like old and aged people, but now a lot of youngsters are also snoring. Yes.
And it's very awkward publicly, especially when you're traveling on flight or in a bus. If you're sleeping, if you sleep off and if you start snoring,
Yeah, it's a bit embarrassing too.
It's a
Some
bit
people
embarrassing.
record and also that-
your friends will
Yeah.
make fun of you.
I used to snore at 90 decibels. Just imagine.
Wow.
It's like noise pollution.
Yes, it's noise pollution. And my colleagues recorded it on their mobiles, and I don't know, it was a big problem. So snoring, people think it's okay, but it's not. It affects your health so much that could be a sign of something worse also. So if you're snoring, you could have a problem.
I think basically snoring or a loud noise comes out of your throat when actually the passage is narrowed, maybe due to muscle relaxation or excess fat or anything. I think it can actually narrow the airway.
So basically, when we breathe, what happens is when we take in air, there is a negative pressure that goes. The lungs will expand, and negative pressure that happens. So the negative pressure pulls all these tissues close together. Normally, when we inspire, and when we sleep, the muscles are more relaxed, so they can get even compressed. And with other factors, different factors, you can have a nasal obstruction, or you can have a thing with which your jaw is inside, or an enlarged tongue, or your palate. What do you say? The
narrow.
the back part of the palate. Yeah, the softer part of the palate and the uvula, and these things can fall down and constrict the airway. So make it a little smaller. So when air goes in and it is turbulent, that's when these soft tissues vibrate and then the sound comes out.
So it can be actually be an indication of some underlying systemic condition also,
Yeah.
right? It should be so like shouldn't it be evaluated like as soon as possible? It might be something not serious also, but it can be something serious also. Don't we?
Yes. So if you're snoring, there are so many primary snorers. For example, if you're sleep deprived, you can snore. Now, otherwise, if you're if it's a person who's consuming alcohol and the other habits, definitely their systems are depressed a little more when
Even
they
your
sleep.
sleep posture can
Yeah,
cause.
even that's exactly true. Sleep posture can cause, especially when you're lying on your back, there's a chance for your tongue to fall back and to
The upper airway
constrict.
will have the gravity action on it.
Yes, so it gets constricted and there is a chance. But definitely if you're snoring, it's not a good sign. It can cause underlying problems or it can be a sign of underlying problems like obstructive sleep apnea. So snoring is a big problem, even in kids.
As orthodontists, when we evaluate the patients, like in cases where there's a retruded chin or a retrognathic mandible, that can lead to that obstruction and lead to snoring and all. So in such cases, we give mandibular advancement devices, MAD we call it. So that can be done. Or in adults, if it is due to retrograde mandible, we can go for surgery, orthodontic surgery, reposition the mandible forward. So all this we can do.
I feel even people with small jaws, small arches,
Yes.
small
and a
arches,
large tongue.
Last time,
large
yes,
tongues.
macroglossia.
So small arches, like if the arch is constricted, like we can go for an expansion of the arch. So that is what we usually give as RME, rapid maxillary expansion, and we have also other modalities like in adults,
adults we can go for
implant
SARPE,
assisted,
surgically
MRP and SARPE.
And when we see people who snore, one of the common queries they ask is whom to consult for. So what is the best answer, George, as you?
See, again, it depends on the age also. Now, there are multifactorial causes for snoring. Now, for kids, it could be the primary cause, could be the tonsils or the adenoids. But definitely, if you visit a dentist can at least evaluate, what is the dental aspects of it. It's basically a multidisciplinary, approach. So there could be dental aspects, and like you said, if it's a constricted jaw, and myofunctional therapy as we call it, so that would be a right way to start. And if the patient has enlarged tonsils and adenoids, an ENT will handle it appropriately. So
basically there should be a collaboration or coordination between medical and dental.
Yes.
So
as a patient, you either need to go to an ENT specialist or you need to visit a dentist. Now, I'm sure people will be visiting dentists a little more often for their teeth. So at that time, all these things can be evaluated. And it is always nice to ask about this condition as dentists. If we just ask them, okay, do you have this problem? Because for kids, it may not, reflect as, it may not be reflecting directly. Sometimes it can be that the child is hyperactive in school, the child is irritable. So that all could be related to their insufficient or, not a good quality of sleep. So, and the snoring and the apnea that comes after that can be a problem, and that will reflect in their activities in school. So, it is not that they are going to directly come to you with a problem like that, because people don't know, So, it's the thing that, it's sound sleep, and sound sleep it's amazing if you snore.
And I feel earlier we have this idea that people who are very obese and heavy, they snore more. I feel even thin people have snoring.
It's true. It depends on the cause, I feel. What is the cause of the problem? So basically, there is some partial blockage in the airway. Obstructive sleep apnea, it's like a complete blockage of the airway. But in a partial blockage also, what is the cause of that blockage is the thing. Now, why obesity is, even I was a little overweight, so my neck circumference was a lot, so I couldn't even wear my tie, which I was able to wear. And in here we get shirts. We don't get custom collar size shirts. It's all in one. Like if you're 40, the 40 will have one kind of a neck circumference, and neck collar. So I was not able to even put the collar button and wear ties. So a lot of fat deposition over here constricted the airway a little more. So that is one reason why they say there is a link with obesity. If you're obese, it can cause that problem. But not necessarily. If it's the cause with your tonsils, or if it's the cause of your jaw, being obese could be an attributing factor and not directly linked to. So there is no hard and fast rule. But in general, the rule is like if you're obese, more fat deposition, there is more possibility of snoring and then OSA.
So basically the risk factor will be more. That's how we can say.
Yes, the risk factor. But again, it's not a hard and fast rule.
I understand.
I've read even alcohol and medicines which induce sleep can also cause snoring.
Yes, so they relax your systems more, your nervous systems more. So the muscles also lose, because here they are free floating. All these muscles are there. It's just musculature that is there. There is no bone that is going to control this. So when the nervous systems are down, the muscles are going to fall or constrict a little more. And if there is, for example, if there is a nasal obstruction, like I do. So once you try to take in air forcefully, your negative pressure is going to be a lot. So, the muscles are going to collapse further. The soft palate is going to, the palate and the uvula are going to collapse further, and it's going to cause a bigger problem. It's like a compounding problem.
The other day I was just going through the literature, and what it was mentioned is, in the world, if you see, less than 50% of the dentists know how to, what to look out for, like when they diagnose. So what should be those main points where dentists should look for, when they
Okay.
see?
So first there is snoring, then there is something called OSA. Okay. So primary snoring is also a problem. It's also a problem because you don't get the good quality of sleep. You're not refreshed, and you're not going to listen. Your partner may not. Because my son used to, he's a little kid, and he used to kick me, when I snore, and my wife kept telling me that I'm roaring like a lion. So it was disturbing their sleep, right? So that with primary snoring, that's a problem. But what happens when you have OSA? OSA is a totally different, it's a different problem because it's going to affect your health a lot. So OSA is when you have a complete block in your airway, and you stop breathing for a little while when you're sleeping. So just imagine that's how difficult that's going to be. So the first thing is to differentiate between, what is going to be, is it a primary snoring, or could it be OSA? The main thing, the first thing that you look out for is going to talk to the patient, you're going to talk to your patients and ask them what is the history, what are your symptoms, what are you going through. So that is the first thing, is to understand, or hear from them what they are suffering from or what they're going through, and that gives you a lot of cues. So I was, I'm diagnosed with OSA, but before I was aware of the problem, I used to have snoring, but I also used to have daytime sleepiness. So I get up in the morning, I'm not fresh, I'm tired, and I don't feel like I've slept. So initially I thought I was not sleeping enough, and then I kept sleeping longer. There's a couple of instances where I just fell asleep and the vehicle swerved, close calls. And everyone were tired. It was a long day, but my wife was awake, and so immediately, she panicked. And so this sleepiness, and maybe this is the cause of a lot of road traffic accidents that happen, because we don't know. So,
and I think there are no much awareness regarding all this, what we were discussing, especially snoring, because I feel snoring is still considered very normal at many places.
And I didn't know much about it.
Yeah, and as George was saying, in relation to with relation to drivers, I feel there have been some studies, and they have actually found a link between the lifestyle of drivers, because they're having a sedentary lifestyle, and it has actually a link with obstructive sleep. Wouldn't you say that?
Could be. So they have already some kind of there could be anatomical considerations. Okay, how their jaws are, how their soft palate is, if they have a nasal obstruction. See, if you have normal allergies, your turbinates, they're going to be inflamed, a lot of mucus. That itself can cause a blockage. That itself can cause snoring. So it's a lot of factors. It can start from the nose. Now, either your septum, the bone in between, can be deviated, like in my case, or you can have some growth in the nose. So there are certain considerations other than their lifestyle. Okay, so it all adds up, and like you said, it's a high chance of falling asleep while you're driving, and I think that's nothing worse than that. My cousin, met with a very, very serious accident, and by God's grace, just scraped through because the driver fell asleep. It was a bridge. The car swerved. Thankfully, the car didn't fall off the bridge. So, so this problem, people are not aware, and I think it's good that we're talking about this today,
because it actually severely affects the quality of life, right?
Very true.
Because many people are not aware about the long-term results, which it is going to happen eventually. Like right now, we are just talking about snoring, but I think in the long run, it can actually lead to many disorders, including hypertension, stroke, and many underlying systemic conditions, which can be very dangerous.
And many are not aware that they themselves have this. That is the main thing. Like they just think that okay, they are tired all the time, or when they drive they feel asleep, but they are not aware about what exactly they have.
And there are, I just read one psychiatric, literature where it said that most of the time when the person sleep off and, they get this obstructive sleep apnea, and then they got up from the sleep and it's like they saw a nightmare. Actually, some people see it's like a quicksand, or that is what they come to the psychologist saying, I woke up from this sleep choking. But actually it is obstructive sleep apnea, and many people are not aware. Like in normal routine, they will be like, okay, I had a nightmare, I had a bad dream, but they are actually undergoing a very bad situation, and lack of sleep and lack of breath. Like they got up because they couldn't breathe.
Just imagine we're all awake and the oxygen is being sucked out of the room.
Yeah.
Yes.
Just
All of a
imagine
sudden-
how much
suffocating.
yes
Suffocating, it will
is
be,
there.
yeah.
And that happens when you sleep. So your brain is going to be on an overdrive, trying to tell your lungs to breathe harder, take in more air, and so that's why when you're waking up you feel so tired.
And especially when we talk about the sleep in our REM cycle, we take the shallowest breath. Like we take very shallow breath, so we are prone to snore in our REM sleeps. So many people, they think that, okay, maybe I'm dreaming or maybe something is happening, but they're not aware, they're just having OSA at that point.
There's a dip in oxygen, you're not getting oxygen, and there's complete cessation of breathing.
Actually, your brain is starving.
Yes, your brain is starving, and that's when you take that gasp.
Yeah, that's how we get up.
So those are arousals from sleep. So many times you don't feel it or you don't know it, and it's your partner or who is beside you or your colleague or whoever is with you who can identify it better. So it's a big problem.
So I had a patient. So he is in the UK. So when he came down, he was having this one. So we gave him mandibular advancement device. So what he was telling is, when he sleeps at night, okay, he wears it and sleeps. But when he wakes up, he sees it outside, like he's lying somewhere out. So such cases and all, what can be the problem?
Okay, so when you're going for treatments, we've gone to the treatment aspect of it. But anyways, we'll discuss this and then we can actually look into how to, what is the diagnosis and how we go about it. Now, mandibular advancement, you're saying the device came out, popped out of the mouth. So one could be inadequate fit. I had this problem. Okay, so with my initial devices, I use a couple of devices. So initially when I wore it, now my teeth don't have that much of a crown height, they're a little short. So if your device is not snugly fit in, there is a chance that, because you automatically tend to open your mouth. Now, why did it happen? Because I had a nasal obstruction, or I have a nasal obstruction. So I didn't realize it then. So I'm trying to breathe through my nose, it's not going through. And then ultimately, sometimes I'm trying to, I'm not getting air, and the device is also not fitting snug. My mouth opens and the device comes out. It must be snugly fit and not, you can't use all mandibular advancement devices, and they don't work very effectively in case you have a nasal obstruction.
So basically, wouldn't you say that it also depends on the severity of the
Yes.
OSA? Yeah, because
Yes.
basically we can use it only for probably mild to moderate cases.
Yes.
That's also should be a factor, right? As in severe cases, we should not depend on.
I think the diagnosis is important.
Yeah.
Yeah.
It's all about knowing about this, and when someone comes to you, you speak to them, find out the underlying cause and try to identify the cause of the problem. So rather than advocating, there are many treatments for OSA, but it's the diagnosis that is basic diagnosis that is important.
So how would you diagnose whether it is whether the case of OSA, the patient is having a severe case or a mild case? So how will we diagnose it?
So the main thing is, first we take a detailed history. Okay, then there is something called a stop bank questionnaire. You have different parameters. So S for snoring, T for tiredness. Like that, you have some questions with the body mass index and apneas and the male genders. Basically there is more prevalence in males compared to females. So, and your neck circumference. So, some of these factors are there. So, you take the questionnaire and then you do a clinical examination. Now, if you're a dental, you look at the dental aspects of it. Definitely, you can also look at the nose and things like that, and the tonsils. And in case of a referral, you would refer it to an ENT specialist or, things like that. But how do you objectively diagnose is by something called, a sleep test. So you can either get the sleep test done at home, which I think is a little better because you sleep more comfortably in your own bed, or you can get it in a hospital. So very different levels of this sleep test. But get a basic home sleep apnea testing would help. So in that, you will get, there are so many readings in that, and the main or the most common thing that people see is called the apnea hypopnea index.
AHI.
AHI. So apnea is basically, why is it called apnea is because there's no breath. And hypopnea, there is a reduction in the oxygen levels and this thing. So how many incidents are happening, in an hour is what is recorded. So that is this AHI. So when you keep it and you're sleeping, how many incidents of apnea and how many incidents of hypopnea are happening in an hour. So it's based on those readings that you say, like up to 5 they consider it little normal, and then 5 to 15 is little mild, and 15 to 30 and it's moderate, and then you go above 30 is severe. So that's basic thing about the 4 criteria. But it's not just AHI. It can be other factors also. Patients, you need to correlate so many things in that sleep test. So what is the position the patient is sleeping? And they have something called RDI, or how much of your respiratory disturbance that is happening. What is your oxygen saturation? What is the lowest point? So you need to correlate different parameters. It's not just one parameter, but the most common thing that people know about is this AHI and apnea hypopnea index. So that's going to be a thing that we look out for. It's not just that. So there are exceptions for everything. Yes, generally we look at these scores and again determine what is the problem.
So as a layman or a lay person, what should be that wake up call? Okay, that should drive him to visit a sleep specialist or a dentist or whoever to treat this. Like, what should be that?
See, if you're having a regular snoring, I think if you snore a lot, I think that should be one sign of it, because snoring is the most common. And along with that, if you have like a blocked nose, continuous problem, continuous this thing, your obstruction can be there. So what patients generally can identify is their snoring, and then their lack of energy and things like that. But if you know that if you have a smaller jaw, if you feel that your jaw is backward, or you visited your dentist and he's told you that,
then advancement should be done.
So it's basically, initially it's going to be a symptomatic approach that and you get to know it, because trust me, I was very tired, and I couldn't function effectively. So that could be the sign. I think the main thing is to give more awareness, so that if it's a dental cause, as we dentists, you can intervene during childhood, and even solve a lot of problems. For example, if it's a problem where there is not enough of growth,
then we can go for a myofunctional appliance.
Yes, you can go for a myofunctional and modify the growth to that aspect, because once you're an adult, you guys know it the best.
Yes.
What we do, what our braces are going to treat is going to be only the dental aspect
dental aspects.
And I feel even in adults with severe attrition cases of collapsed vertical dimension, in such cases we have literatures which says rehabilitation can improve. It will increasing the vertical dimension will create more space.
Just as you said, it's like when you're doing a full mouth, you can keep that component also in mind. So it's all about whatever treatment that you're doing, to keep in mind that the airway is an important aspect of it. And if you're going for if you're an adult and there's only one way to do it, either you have to if it's your upper, the maxilla is constricted. So there's only one way is to expand. See, maybe you can
Yeah,
talk about
surgically
it.
assisted rapid maxillary expansion, where the palatal vault is, split open, and then expanders are given, so that this can lead to a increased size, or the arch expansion skeletally it can be achieved. So this in turn will, increase the airflow, so that will reduce the snoring and reduce the symptoms of OSA.
So how long is it? How long is it usually? What is the period that it takes, and how much can you?
Say for a normal RME case, I'm talking about for children below the age of 15 years. Usually RME, how we give is we keep the appliance in place and we do an expansion. Ideally we give an expansion so that the lingual cusps of maxilla come in contact with are superimposed on the buccal cusps of the mandible. Ideally what we do is, because we overcorrect it a little, because there is a high chance of relapse.
The
relapse also happens. So we take that into consideration. That's how much is what we should ideally expand. And then we will actually, once that expansion is achieved, we keep it in place for a period of, at least for a period of 4 literature it actually varies. Some people say 3 months and other clinicians have done it up to 6 months. So this retention period, and after that the appliance is removed and we can continue with the conventional treatment, that is braces treatment, and to correct the other discrepancies. So that is how we expand the, while this happens, the airway also expands, and the tongue can also occupy that space, and it will help in improved breathing.
Yeah, and if it's because of your inadequate jaw growth, you need to do maxillomandibular advancement surgery. So the thing is, how many of us are willing to go under the knife for that kind, those kind of surgeries? So if you treat it young, you catch it young, and that solves a majority of the problems. And I think that would give a better prognosis for the problem.
And nowadays, pediatric OSA is also on the
yes,
rise.
I think it's always been there. Just that we didn't know about it. For example, yesterday my son has an infection. He's on antibiotics and his nose is blocked, and last night I could literally hear the snoring. So it's just that now that can happen. Now he's got a stuffy nose, but if this happens all the time, then there are some alarm bells that are there. So the muscles of your neck, yeah. These exercises can help lose weight.
Body shaming.
Yeah, body
That should
shaming.
not be habit.
You got to lose weight, and it's.
So at least I hope, with this, it will open a channel in.
How many people would be suffering? Millions are suffering in our country. Millions. We should give a space where people can put out their stories.
Yes.
Right? Don't you think that would be a great idea?
Yeah, that will be great.